The Atlantic horseshoe crab, Limulus polyphemus, has long been valued by the biopharmaceutical industry as a source of critical proteins that detect the presence of harmful bacterial endotoxin. Called Limulus amoebocyte lysate, LAL, these proteins come from the animal's blood cells, amoebocytes, and serve as the foundation of the LAL endotoxin test. In the 50 years since its discovery, LAL has proven to be the most sensitive and effective indicator of endotoxin contamination in treatments like vaccines, IV drugs, and medical devices. At least 10 times more sensitive than traditional test methods, LAL can detect as little as half a picogram per milliliter of endotoxin, equivalent to 1 grain of sand in an Olympic-sized pool. Because it is a natural, renewable source of LAL, the horseshoe crab has become the focus of tremendous efforts to preserve and protect this incredible creature. In 1992, EndoSafe founder Dr. James Cooper wrote draft legislation to regulate horseshoe crab fisheries. As a result, South Carolina enacted laws to protect its indigenous crab population. In combination with the efforts of advocacy groups, the laws have served to preserve the animal's natural habitat and prevent their use as bait. South Carolina is now home to 8 island sanctuaries. Conservation efforts have spread to span the eastern seaboard. The Atlantic States Marine Fisheries Commission now mandates that all Atlantic coastal states identify horseshoe crab nesting beaches. Charles River is committed to the conservation of this extraordinary species that contributes to the everyday health and safety of people and animals all over the world. As a responsible manufacturer of LAL, we are proud to play a role in alleviating pressures on the horseshoe crab through active animal welfare campaigns, decades of R&D, and scientific innovation. Each year, our highly controlled and monitored bleeding programs begin with hand collection of crabs, performed by our licensed fishermen in local South Carolina waters. Our technicians practice humane care throughout the health inspection and blood collection processes, and animals are returned to the sea within the same day. Continuing our conservation, we strive to do more with less. We've developed FDA-licensed LAL cartridges that use 20 times less raw material than traditional LAL tests. We are constantly refining our cartridge technology so that responsibility rather than demand can continue to guide our operations. Used in our portable endotoxin testing systems, our LAL cartridges produce point-of-sample results in just 15 minutes. It is critical that we serve as advocates for the humane treatment of horseshoe crabs and strive to achieve balance between our need for this valuable material and the livelihood of the animal that provides it. To learn more about how we are helping safeguard the continued population growth of the horseshoe crab, please visit hsc.criver.com.